We have to work with the best materials. Atrophy of the mandible gives us quite challenging situation when we want to place implant in the posterior area. With it, we have to work with the best materials to fill the defect that I perform during the procedure. Actually make a window on the lateral side of the mandible and take it out. And then we have to fill it and be very gentle around the nerve and the bundle when we put it on top of the or aside the implants. So the use of xenograft materials such as the cerabone and the cerabone plus enable, without pushing the material, just placing it there, enable to fill this defect. And on top of everything, I put together with natural material as PRF or PRP or PPP, which is platelets poor plasma, I put the Jason membrane, which I like very much. We know since many years, I think the beginning of the 60s, already published that each time we raise a flap, we lose some bone. And people must know it, especially those GPs and surgeons, oral surgeons who deal with the tissue, needs to know that big flaps bring big resorptions. And nevertheless, sometimes we have to perform flap procedures. So each time I raise a flap, I do augmentation procedures. So I take this opportunity to add some bone, to add xenograft material such as the cerabone plus, together with PRP or PRF, in order to prevent further resorption due to the jeopardizing the vascularization at time of flap procedure. Usually what we have done in the past, we waited a period treating with antibiotic and waited a few months, and then we performed the augmentation procedure. I have now more than 10 years experience in placing xenograft material at time of augmentation. So the question, why not to use the gold standard autologous bone? Because I don't want to jeopardize the patient's own bone and to open another location for harvesting bone, which I will do as a second procedure if I need more bone 6 months after. So at time of augmentation, when I do it after removal of infected teeth or implant, I use always xenograft materials.